Ever wondered how depression differs from regular mood fluctuations? Well, it's not as simple as feeling sad. Depression, in medical terms, is a persistent mood disorder that goes beyond the casual ups and downs of life. It's not just a case of the blues, but rather a constant struggle that affects every aspect of a person's life. It's like a shadow that lingers, casting a gloom over moments that should bring joy and making the ordinary tasks seem extraordinarily difficult. This is not a condition to be taken lightly. It's a real medical condition that affects millions of people around the world. It doesn't discriminate, striking people of all ages from all walks of life. It's not a sign of weakness or something one can just snap out of. It's an illness, just as real as heart disease or diabetes. So, depression is far more than just feeling blue. It's a complex and serious health concern. Depression doesn't just affect your mood. It brings a host of symptoms that can interfere with your daily life. Let's delve into these symptoms, which often go unnoticed or misunderstood. The most common symptom is a persistent feeling of sadness or emptiness, like a cloud that won't lift. This isn't just a one-off bad day, but a constant gloom that lingers for weeks or even months. A loss of interest or pleasure in activities once enjoyed is another telltale sign. This might mean no longer finding joy in your favorite hobbies, or even everyday activities like eating and socializing. Changes in sleep patterns are also common. This could mean struggling to fall asleep, waking up too early, or oversleeping. Similarly, appetite changes might occur, with some people eating too much while others lose their desire to eat. Lastly, feelings of worthlessness or excessive guilt are a heavy burden many with depression bear. This may involve harsh self-criticism and an overwhelming sense of guilt. These symptoms can be debilitating, and they persist for weeks or even months. Depression comes in many forms, each with its unique characteristics. Let's delve deeper into this. Major depressive disorder, also known as clinical depression, is characterized by persistent feelings of sadness or a lack of interest in outside stimuli. It's not just a case of the blues, but a long-lasting debilitating condition that can significantly impair a person's ability to function in their daily life. On the other hand, dysthymia, or persistent depressive disorder, is a form of depression that lasts for at least 2 years. It's less severe than major depression, but can still disrupt life in significant ways. Then we have seasonal affective disorder, which typically occurs during the winter months when there's less natural sunlight. It's often characterized by moodiness and a tendency to oversleep. These are just a few examples, but the spectrum of depressive disorders is broad and diverse. Recognizing the different types of depression can help in understanding and treating this complex disorder. Depression doesn't have a single cause. It's a result of a complex interplay of factors. To truly understand depression, we must grasp its multifactorial nature. This means that it isn't caused by just one thing, but by a combination of genetic, neurobiological, psychological, and environmental factors. Let's start with genetics. Some people are more susceptible to depression due to their genetic makeup. It's not a guarantee, but it does heighten the risk. Then we have neurobiological factors. This relates to the physical and chemical processes in our brain. For example, imbalances in certain neurotransmitters can lead to depression. Psychological factors are also crucial. This can include personality traits, coping mechanisms, and cognitive processes. Someone with low self-esteem, for instance, might be more prone to depression. Lastly, there are environmental factors. These include life events and circumstances such as losing a job, a loved one, or dealing with chronic stress. Depression is a complex disorder with numerous contributing factors, making it a challenging condition to understand and treat. Certain risk factors increase the likelihood of developing depression, and it also has a strong link with physical health. Let's delve into these risk factors first. Family history plays a significant role. If depression runs in your family, you are more likely to experience it yourself. Trauma, especially early life trauma, can trigger depression later on. Chronic stress is another major risk factor. When stress becomes a constant companion, it can pave the way for depression. Now let's talk about the relationship between depression and physical health. It's a two-way street. Depression can lead to physical health problems, and physical health problems can also lead to depression. For instance, chronic conditions like heart disease or diabetes can heighten depression risk. Conversely, depression can contribute to physical issues like pain, sleep disturbances, and even heart disease. Depression doesn't exist in isolation. It's closely tied to various risk factors and physical health issues. Depression isn't just psychological, it's rooted in our biology. When we delve into the neurobiological basis of depression, we find that it's closely tied to imbalances in certain neurotransmitters. These are chemical messengers that transmit signals across the neural network in our brain. Two key players in this complex process are serotonin and norepinephrine. Serotonin, often dubbed the feel-good neurotransmitter, regulates mood, sleep, and appetite. Imbalances in serotonin levels can lead to feelings of sadness and anxiety, typical symptoms of depression. Norepinephrine, on the other hand, is linked to alertness and energy. Low levels of this neurotransmitter can result in fatigue, loss of interest, and decreased concentration, again pointing towards depressive symptoms. So you see, these neurotransmitters act like an orchestra, with each playing a crucial part. If one falls out of tune, it can disrupt the harmony, leading to depression. Our brains play a significant role in depression, further proving it's more than just a state of mind. Diagnosing depression involves strict criteria to ensure accurate identification and treatment. It's a process that takes into account both the intensity and duration of symptoms. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, is a resource commonly used by clinicians. It outlines a set of criteria that must be met for a diagnosis of major depressive disorder. A person must exhibit at least 5 symptoms during the same 2-week period, and at least one of these must be either a depressed mood or a loss of interest or pleasure. The symptoms must also cause significant distress or impairment in social, work, or other important areas of functioning. Importantly, they should not be attributable to the physiological effects of a substance or another medical condition. These criteria help clinicians accurately diagnose depression and provide effective treatment. Remember, accurate diagnosis is the first step toward recovery. Depression diagnosis isn't a one-size-fits-all approach. It requires comprehensive clinical assessment and detailed patient history. But why is this so important? Well, let's dive into it. Depression, as we've discussed, is a complex disorder with a variety of potential causes and symptoms. It can manifest differently in each individual, making it a bit of a chameleon in the world of mental health disorders. This is where the importance of clinical assessment comes into play. A comprehensive clinical assessment helps to paint a holistic picture of the patient's mental health. It's not just about ticking boxes on a checklist of symptoms. It involves a detailed exploration of the patient's emotional state, personal and family history, lifestyle, physical health, and any other factors that could contribute to their mental well-being. This thorough evaluation is essential because depression often coexists with other conditions, both mental and physical. Sometimes symptoms of depression can mimic or be caused by other medical conditions, like thyroid problems, vitamin deficiencies, or brain tumors. Therefore, it's crucial to rule out these conditions before confirming a diagnosis of depression. Moreover, the assessment helps in identifying other mental health disorders that may be present along with depression, such as anxiety disorders or substance use disorders. Identifying these coexisting conditions is key to formulating an effective treatment plan. But it doesn't stop there. A comprehensive clinical assessment also plays a vital role in monitoring the progress of treatment. By comparing the patient's current state with the baseline established during the initial assessment, healthcare professionals can gauge the effectiveness of the treatment and adjust it as necessary. Lastly, let's not forget the importance of a detailed patient history. Understanding a patient's past experiences, traumas, and family history of mental health disorders can provide invaluable insights into their current mental state and potential triggers for their depression. In conclusion, a thorough clinical assessment is not just a formality. It's a crucial tool in the arsenal of healthcare professionals, aiding in diagnosing depression accurately, ruling out other conditions, and formulating a personalized treatment plan. A thorough clinical assessment is crucial in diagnosing depression accurately and formulating a personalized treatment plan. Depression is treatable. Let's explore how. When it comes to treating depression, a multifaceted approach is often the most effective. This can include psychotherapy, medication, and lifestyle changes. Psychotherapy, or talk therapy, is a powerful tool. It helps patients understand their depression and equips them with strategies to manage their symptoms. Cognitive behavioral therapy and interpersonal therapy are two common forms of psychotherapy used in treating depression. Medication is another key player in the treatment of depression. Antidepressants work by balancing brain chemicals called neurotransmitters that affect mood and emotions. Selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed antidepressants. And let's not forget about lifestyle changes. Regular exercise, a healthy diet, adequate sleep, and reducing alcohol intake can significantly improve symptoms of depression. With the right treatment, people with depression can lead fulfilling lives. Remember, there's always help and hope. Depression is a complex disorder, but understanding it is the first step towards managing it. We've journeyed through the labyrinth of depression, beginning with its definition as more than just a mood swing. We've delved into its primary symptoms, from persistent sadness to changes in sleep and appetite, and feelings of worthlessness. We've examined the various types of depressive disorders, including major depressive disorder, and highlighted their multifaceted causes: genetic, neurobiological, psychological, and environmental. We've discussed common risk factors, including family history, trauma, and chronic stress. We've underscored the bidirectional relationship between depression and physical health. We've explored the neurobiological basis of depression, involving neurotransmitter imbalances. We've outlined the DSM-5 criteria for diagnosing depression and emphasized the importance of a comprehensive clinical assessment. Finally, we've touched on the latest treatment approaches, underlining the importance of professional help. Remember, depression is a serious but treatable condition. If you or a loved one are struggling, don't hesitate to seek help.